to liberate is in line with the entourage of the infection or any other foreign bodies. In this case, we are talking of Plasmodium falciparum, which causes malaria. And remember that we said we have got 4 types of parasites that causes this malaria. So it's not only Plasmodium falciparum that might trigger all these symptoms, but all of them that we have mentioned, the vivax, the ovale, and the malaria, plus the falciparum, and they have got all capability of exhibiting this kind of symptoms. Yeah, that's what we can talk about the clinical presentation or signs and symptoms of malaria.
Malaria. Okay. Now, all right. Now, are there any stages of malaria, or does this just come like with a big punch, like just seeing these symptoms, or what exactly happens? Can you tell us what exactly happens? What are the stages of malaria, if there is any?
In fact, each and every disease has got its what we call the pathophysiology as well as the etiological system. In this case, we are talking about, in a simple, we can say stages of malaria in this case, whereby the first stage is the incubation stage. The incubation stage shall imply that the individual has been bitten by mosquito which has carried Plasmodium of the 4 above we have discussed. It can be Plasmodium falciparum, ovale, vivax, or whatever. When it is entered in the body, that is the incubation stage. So that incubation stage, it starts from 7th day up to 40th day. From day 0 up to 6th day is when the body reacts against that foreign bodies, and from day 7 up to 14 is at the incubation stage, whereby there is a very strong battle between the malaria, Plasmodium, as well as the individual body immunity. So the one who has got a weak point there, it gets defeated. But with malaria, most of the time, the individual gets defeated. So when the person has been defeated, the individual gets defeated within the specified period of mentioned, 7 to 14 days. Then from that phase, it comes to acute phase. In acute phase is when we see clinical presentation like fever and chills. That means there is still more aggravation of immunity on its efficacy to fight against the foreign body. In this foreign body, we are talking of Plasmodium falciparum or other falciparum species. All those things will be seen in that acute phase. And in acute phase is when the individual will become sick, whereby if he or she is presenting with the fever, chills, and the other symptoms, as we put it above there, will be being exhibited, like fatigue, headache, general body pains, abdominal pains, nausea and vomiting, diarrhea, as well as other clinical presentation. However, clinical presentation differs with different individual. Every different individual will present with its present clinical presentation. Others will not exhibit any clinical sign of malaria, but if they get tested, they will exhibit malaria positive.
Okay.
Yes, while the vice versa is true.
Yeah.
Yes. Then we have got the chronic phase. In chronic phase is the recurrent or episode phase. Recurrent shall mean that the patient has been given malaria treatment, but still more, he or she is not getting cured. That is called recurrent episode. In other condition, we say is a treatment failure. And treatment failure is when the medication given to that individual has failed to combat the malaria species.
Okay.
Yes.
All right. Now, how do you diagnose malaria?
There are only two ways that we diagnose malaria. Number one is through blood film. The blood film is whereby we collect the blood sample. Most of the time we need a fingertip sample, blood sample. We put it on the glass slide. Then all the processes are done. After staining, we stain it. We are dried. Then we analyze it on the microscope where there are mycobacteria, where there are Plasmodium species. They are being observed, or they will be noticed on the slide, and from there we make a decision. Or we can do what we call rapid diagnostic test. These are the simple tests. Most of the time they are not well trusted, because in other phases of malaria they fail to give us a positive or negative results. Or what I can say is they are not gold standard. The gold standard is the blood film. So rapid diagnostic test can be used to test malaria, but when things are very severe to the patient, we encourage to do what we call the blood film using the microscope, as I've explained. Yes.
All right, listeners, in case you're just joining us, today's program we're discussing malaria. So far we've discussed the overview of malaria, what causes malaria, how is malaria transmitted, what are the risk factors of malaria, signs and symptoms. Yes, now, are there any complications with malaria to a person? What are the complications, Mr. Josam, if there is any?
Every disease has got its complication. In the case of malaria, it has got some of its complications, like anemia. Anemia comes because Plasmodium species, most of the time they attack the red blood cells. The red blood cells, when they get burst up, then they get degenerated, in so doing reducing the number of red blood cells, thus shall imply anemia. Number two, it might result into cerebral malaria. Cerebral malaria comes because it might, most of the time, or in other cases, this Plasmodium species might migrate to the brain, which can damage the brain cells and thus cerebral malaria. Another complication is organ failure. In this case, we are talking of it can be the kidney or the liver. Most of the time, the liver, because it's where the other stages of malaria takes place, so that the disease itself, it takes place in the liver. So the most affected cells in the liver, the Kupffer cells, which not Kupffer cells as such, but most of the time the liver cells, they are being affected because of malaria, as well as kidney. As a kidney is the one that produces does the role of excretion. And in addition to that, there's a respiratory distress. Respiratory distress comes because, as I said, that malaria attacks in the RBCs, and the RBCs, they are air for transporting oxygen or for gases exchange. So when they are in low amount, we expect that the individual might not have enough capability of having respiratory exchange of perfect in nature. As such, respiratory distress results.
All right, thank you, Mr. Joseph. As we going to an end of our program, let's now go to prevention. Is malaria preventable?
Yeah, malaria is very preventable by just following what the causes and the predisposing factor above, as we said. We need to prevent malaria by doing the following. We need to use mosquito repellent, whereby those things will be able to chase mosquito away. As such, you will not be bitten by malaria. As such, you are safe.
Yes.
Number 2, protective clothes. As I said already that we need to put on a long sleeves clothes, especially in the endemic area like in Sanja and Chihuahua, so that we should not be bitten by malaria. As such, we eradicate ourselves from malaria issues. Number 3 is insecticide-treated bed nets. When you are sleeping, we need to make sure that we are sleeping in the well-treated mosquito net, not just mosquito net, but the treated mosquito net with insecticides, mosquito insecticide. So those are some of the ways how we can prevent malaria. In addition to that, there are vaccine that is being under trial. So that vaccine is not yet being publicized or being adopted as one way of as the other vaccine are being utilized in as far as expanded program on immunization is concerned. So it's just a trial. After being recommended, it shall be in use.
I think it also has a treatment. From what you're saying, what is the treatment of this?
Most of the time, treatment varies with the severity of the condition, because we have got different kind of treatment of malaria. Before we started using what we call lumefantrine artemether, LA, the first drug of choice was quinine, chloroquine, meroquine, as well as sulfadoxine, pyrimethamine, that fancied SP. But because of science and the other sophisticated investigation done on malaria, all these drugs that I've mentioned have been phased out. Now we are using what we call lumefantrine artemether as the first line drug, although now is being phased out again. Now we are much more treating the malaria using artesunate. Artesunate is the best drug as of now, though it is injectable, but most of the cases we are treating it with artesunate. Although lumefantrine artemether LA is still being in use, but WHO and the other health experts, they are working on phasing it out to replace it with artesunate. That's how we are treating malaria plus those preventive measures. There are only two drugs that we use for malaria. That's what I can say about the treatment.
Let me thank you, Mr. Joseph, for joining us today in today's program as we were discussing malaria. That is all we had on today's program on the Health Issues podcast. Today we were discussing malaria. Let's be there on the next program as we will come again with another medical condition. You were with me, Livness Mchoga, the producer and the editor of the program.